We'll have questions after the next speaker for the sensory and oral health part of the session. Our next speaker is Dr. Athena Pappas, and she is the Erling Johansson Professor of Dental Research and the head of the Division of Oral Medicine at Tufts University School of Dental Medicine in Boston, Massachusetts. With expertise in the oral health care of the elderly, medically compromised, surgeons, cancer, I don't know if I said the disorder incorrectly, and bone marrow transplant patients, Dr. Pappas has been the principal investigator of over 100 clinical trials. And she's done research on the interrelationships of nutrition and oral health in an aging population at Tufts USDA. And she's going to talk about, of course, nutrition and oral health and aging. Dr. Pappas, thank you.
Thank you. I know it's late in the afternoon, and I'm going to rush you through Dentistry 101. So the face of dentistry is changing. Previously, old age was dentures. Not anymore. I'm not going to end up with my teeth in a glass. And if you look at the generation that's going to follow me, after the baby boomers, we're going to have less and less people having dentures. We're already doing implants galore. People just don't want to give up their teeth anymore. And unfortunately, those teeth that we're keeping are not healthy. If you look at, if you look at root decay, it's the most common type of dental disease you have. As you get long in the tooth, the root that gets exposed is much more likely to decay than the crown. The hardest tissue in the mouth is enamel, and then the next hardest is dentin, and then bone. So, if you look at spending, you can see that the older population is outspending everybody else. And if you kick in autoimmune disease, they spend 3 times what their peer controls spend. And that's due to lack of saliva. So in the 80s, 2 studies were done. One was the nutritional status survey by the Human Nutrition Center on Aging to come up with dietary recommendations. And then we at the dental school took about 1/3 of the people in the nutritional status survey and followed them for 3 more years and added people from the inner city, went and did geriatric outreach to 30 sites. So our population was more representative of the Boston population and had more African Americans in it and less educated people as well. And what we found was that for across the board, for both studies, calcium intake was low in both groups. But when we, is there a pointer? I guess it's not working. I pushed there and it's not. Okay. Well, what was found was that in the oh, okay, thank you. In the lower consumption quartiles, here's 50%. As you lost teeth, the consumption of calcium went down. So people who are losing teeth for about 20 different nutrients consumed less food and less total vitamin D. So when people had partial or full dentures, and in the nutritional status survey of the free living, only 50 had full dentures. We're talking partial dentures, partial edentalism. So you can see that vitamin D was down, and in Boston, unless we supplement in the winter, we don't get vitamin D. So we also looked at Best Dawson Hughes's data and saw that people who were losing bone were also losing teeth. And what happens is that when you don't have enough bone density, you get more periodontal disease as you lose calcium and vitamin D. So you can see that across the board, whether you looked at bloods or whether you looked at diet, the nutrient quality of the diet significantly goes down as you lose teeth. And one of the things that we're saying to people is eat green vegetables, green and yellow vegetables, increase the fiber in your diet. Well, not if you don't have teeth, or even if you lose a few teeth. So look at how that translates into what happens to your general health. You change your diet because you haven't got your teeth, and now you have more of a chance of a stroke or a coronary heart disease or diabetes. So, and then what happens to the sugars in the diet? You're covering the palate. We're talking about taste. People start eating more sweets, more baked goods, more chips, crackers, and even the educated people who were college educated tried to eat a little bit better, as opposed to the high school or less educated people who had a lot of refined carbohydrates and a lot of sugars in their diet. But even not as good as having your own teeth. And look at croup fiber. Even if you're educated, you still can't chew the fiber that you need. So what does that look like in terms of weight, skin fold, albumin, carotenoids, vitamin B12? All of these are reduced in the people who have lost teeth. And this is more recent data that looked at edentulous. So what was true 20 years ago is also true today, that the people who are edentulous have more metabolic syndrome. So, and as the number of teeth go up, the metabolic syndrome goes down. So in the NHANES data, full dentition had the best chance of having a healthy diet, whereas 79% of those who were wearing dentures had metabolic problems. So we're talking a very high level. And so you have an inverse relationship between number of teeth and so in our studies, we also looked at periodontal disease. And again, those people who had periodontal disease, again, consumed less fiber. So it started even before you lose the teeth. And you can see that, again, periodontal disease goes up with age. And if you look at antioxidants and periodontal disease, both in our studies and B vitamins, and in the NHANES database, you can see that as the vitamin C goes down, the periodontal disease goes up. And you all know about scurvy, right? And the horrible gum disease that occurs with scurvy. And I've only seen one case in my life, but in any case, when you're looking at associations of periodontal disease, you can see that as you get older, males, smoking, and vitamin C are all important factors from the NHANES database. So diet is affected, and if you can keep your own teeth, keep that in mind. And certainly, we talked about osteoporosis earlier. So we really want to maintain our teeth, and we want to maintain our diet. The link goes both ways. So if you don't have, as you could see, nutrition affects periodontal disease, affects tooth loss, and tooth loss affects diet. It isn't a one-way street. Now I'm going to bring in xerostomia. People who are 60 plus, 88% of them are on medications. One of the biggest problem I had in doing this study of medications was finding people over 60 who don't take any medications. So we compared people who had medications, and if you look at the number of teeth here, you can see the people on medications had fewer teeth, and they tried to floss more. And don't listen to anything about flossing. Floss or die, I say. If you don't want periodontal disease, please floss. Okay, so we had trained and calibrated examiners, and we looked at the increments according to medications. So you can see that people who are on multiple medications have more coronal and root decay. And as I mentioned earlier, older people tend to have more root decay. And when we looked at metabolic syndrome, we found that those who had metabolic syndrome had more tooth decay. So one of the things that we did was we did the block food frequency questionnaire and then added the 100 most frequently eaten carbohydrates, since we're dentists and we want to look at sugar. And you can see that compared to healthies, the people who have a dry mouth, and I picked the psychiatric group because they had the most sugar in their diet. But you can see that they tend to eat cakes and cookies and a little ice cream that makes them feel a little better. And then they put the candies in their mouth because it helps stimulate saliva. Stimulate saliva, but with xylitol gum, please, or mints. So for those of you who say that sugar isn't important, you can see that when you're looking at predictors for Caries incidence in this 3-year study, we found that sugar was highly significant, along with psychiatric medications. And of course, if you have decay, you're going to get more decay. So on the periodontal disease side, it's obviously the greatest increase was among the diabetics. But again, metabolic syndrome was also high in the increase of periodontal disease as well. And in intervention studies, it takes the addition of an antibiotic of some kind plus scaling to help prevent things. Now, looking at this group of medicated individuals, we found that those who took a multivitamin had less increase in the severity of periodontal disease. And also those who supplemented with calcium. And we found something very unusual with vitamin A. If you have too little, it's bad for you, and if you have too much. But if you have too much vitamin A, it can affect bone density. And I think that's why the high intake of vitamin A was detrimental. So on the consequences of saliva hypofunction, drinking water doesn't do it. Because they're proteins that prevent infection. There's the remineralization, lubrication. It's how you form a bolus to swallow your food. And you can get candidiasis and horrible infections, sialolus forming. Sjogren's syndrome is a disease that we've been following. It's an autoimmune disease that affects women 9-to-1. And the salivary glands can swell up and you can look like you have mumps permanently. My patients don't look like that. I drain these glands and I keep them healthy. They chew gum all the time and etc. But it's a 9-to-1 female disease, and there are up to 4 million women who have this disease, but I have children as young as 7 with this disease. And you can see that you get very dry to the point where what's supposed to be water here turns into mucus. And with the loss of saliva, the decay goes up, and acid reflux goes up in this population to the point where the pulp is exposed from the acid eating. Sorry for the ugly pictures. And again, if you look at our radiation population and our Sjogren's population, again, they consume a lot of sugar because it makes them feel better. So I was asked to throw in microbiome too, so here it goes. We looked at the oral microbiome in Sjogren's, in healthy, and in periodontitis. And what we found was that as the saliva goes down, we get fewer microorganisms. And the periodontitis was the largest group, and they specifically have what we call the red complex, and it's this bacteria that's been associated with the heart disease, etc. So if you look at the various groups, what was very interesting about, so this is the red complex right here that the perio group has. And if you look at the healthy versus the Sjogren's. The Sjogren's patients did not have any of that red complex. So they don't get long in the tooth because of deep pockets. They get long in the tooth because of recession and inflammation. And we found that we have two major potential biomarkers from the microbiome. And V. parvella is not a pathogen by itself, but when it comes with a pathogen, it augments the actions of that pathogen. So Sjogren's patients have a lot of oral infections, a lot of lung problems as well. So to cut inflammation, we tried omega-3s because we found that these patients were omega-3 deficient, and we found that it helped with periopockets, dry eyes, and dry mouth. There have been several studies with omega-3s. And we did quick follow-up studies that showed that in terms of survival, this is the NSS data. If you have dentures, you're more likely to die sooner. And then we looked at who survived and who died in our nutrition and oral health study. And you can see that the people who died had fewer teeth. And having 23 or more teeth seems to be the posterior pairs make a difference. This is national data that shows that as the number of teeth go down, so does survival. So it's been verified by other studies as well. So loss of dentition can lead to poor nutritional quality of the diet and can ultimately affect survival. Thank you.